Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned gynecologist and obstetrician who has an extensive experience of more than 4 decades. And she is none other than Dr. Sunanda Kulkarni. She is the gold medalist from MBBS in gynecology, and then she did her MD and she retired as the head of the department from Bangalore Medical College. And now she has continued her service even at her age for a free service at the Chinmaya Mission. And not only that, she is a prolific writer. She has written many books for the students, the doctors, as well as for the public. And welcome, Dr. Sunanda.
Uh, th- Thank you for giving me an opportunity.
Yeah, it is, you remember when we started medical profession, and that time, wherever we went for any function, people used to say backache and white discharge. But now, today, the things have changed. The moment they see a doctor, lady doctor, they say, oh, I have got PCOD, I have got PCOS. And what is this PCOD, PCOS? Suddenly that has cropped up, and it appears that almost all the younger generation are afflicted by this PCOD. What is it? Please tell us.
See, PCOD, there is a difference between PCOD, PCOM, and PCOS. PCOD is a polycystic ovarian disease. This and PCOS is a syndrome. Syndrome means many, it consists of many
Symptoms and
things,
signs are all
many
included.
symptoms and signs. So in PCOS, there is insulin resistance, and then morphology of the ovary, it is increased in size, and many follicles we will see, and the volume is increased, and then they will have complaint of infertility, and obesity is there, and the hair growth, or many things.
On the
That is
face,
syndrome.
yeah.
Okay. And only
And
PCOD is
receding hairline like the men.
men, and the partition, it goes on
It becomes
increasing,
wider.
wider. So
And
this
they
is
have
this
the
is the
black
difference.
pigmentation on the neck.
Yeah, so there are many complaints. They will may complain of. Sometimes they may have depression also, anxiety because
Okay.
of their weight. They feel odd in the school, in the college, because they are fat, and their friends, they look young, and these
These people, they look older.
people, they feel they are aged, so they feel a little bit depressed also. So these patients, they come with a history of the gaining weight, and then the upper lip and lower lip, the hair growth, and then they may have growth on the other side of the other parts of the body also, and they may have the blackening of the black here neck, at the nape of the neck if it is severe type, and then hair distribution already I have told, and they may complain of they don't have children, difficulty in getting pregnant, and they may have irregular cycle. So
Irregular
first
periods.
3 years of the adolescent age, around 14, if the woman gets the period, first 3 years you have to leave it. There may be irregularity. Afterwards, it will become regular. But here they may get once in 2 months, once in a blue moon they get 3 months, and it lasts for 20 days, 15, 20 days like that.
So
So
it
they feel it's a
continues.
heavy,
Okay.
continuous.
Heavy
That's why
period.
with all these complaints they will come.
Okay. Now, when they come with these complaints, you take the history, you examine, and then what are the investigations you get done for them to
So we
say
do
that
the
they have got PCOD? Yeah.
because there is a insulin resistance. So we have to
Yeah,
do some tests
diabetics.
to find out fasting blood sugar, postprandial blood sugar, or HbA1c, that we'll see. And then we do thyroid also, because there is a hair growth,
I
to
know.
rule out
Hair
that.
growth and also
And
the obesity they may be having.
obesity,
Okay.
and then we do the prolactin level, because in prolactin also, if the prolactin level is high, they may have a long period of amenorrhea, and then followed by bleeding. So we have to
Okay.
do all that test.
Okay.
Then we do this scanning, and either we do abdominal scanning or we can do vaginal scanning. In vaginal scanning, it appears better. So these are the
Yeah, but
investigations we do.
vaginal scanning is done for the married thing. Otherwise,
Married.
unmarried girls, it is a youngsters, it
We
is
do
just
abdominal,
abdominal. Yeah.
and there are other causes of hair growth, like adrenal tumors, and then there may be some ovarian tumors also producing male hormone. So, and then adrenal cancers, and then pituitary tumors. So we have to rule out all that. If you
All the
suspect,
dangerous
yes,
conditions.
yeah, if you suspect, then in that case we have to do other investigations to rule out, like a
Okay.
17 OH will do, other
Mm.
things, and then MRI, CT scan of the brain. Other things also you have to do. Otherwise, these are the
Okay.
common investigations which we do.
Okay. So now we have done the investigation and the report comes as a PCOD. What does it mean? If it comes as PCOM, what does it mean? If it comes as PCOS, what does it mean?
So PCOM only morphology is there. They
Mm.
may not have any symptoms. So
Okay.
then we see sometimes make some due to some drugs also you can see like that. And in
What
adolescent
type?
age,
Which drugs? Okay.
and
Mm.
in them also we can see.
Mm.
So in that case, and in adolescent age also we may see. So you
Mm.
need to give assurance.
Need not
Don't
worry
take
about that. Just
it.
reassure and
No.
send them.
No.
Okay.
And then if there is a this only you ovaries,
Mm.
and they may not have any complaint, we have to see. And then if there is insulin resistance, then we have to treat them.
Treat them. Yeah,
And then
yeah.
there, because there is a long-term and short-term effect of this PCO.
Very important.
The
Yes.
short-term effects are irregular cycle, okay,
Okay.
and then hair growth, and then the obesity, and then
Mm.
the infertility, and
Mm.
then depression,
Mm.
okay, and then blackening. All these are the short-term effect. Long-term
Okay.
effects are they are more prone for breast cancer, endometrial carcinoma is more in them, and then they may have hypertension, they may have
Okay.
diabetes,
Diabetes.
and they
Yeah.
may have this sleep apnea because of the
Okay.
obesity. Okay,
Okay.
and then they dyslipidemia. So this lipid
Lipid
profile, everything they
cholesterol
may become
also will
normal,
be
and they may
problem.
have
Yeah.
cardiac disease also.
Yes. Yes.
Yes. So these are the long-term effects. There are
Okay.
short-term and
Okay.
long-term. So we have to treat them early. So if
Yeah.
you treat them early, you can
Yeah.
prevent
Prevent the long-term complications occurring
complications
like the
like
heart
the
attacks
endometrial
and yeah,
cancer and
yeah,
all.
cancers and all those things can be prevented if they're treated in time.
Okay.
So that is very, very important. So when that is so important, what do you advise the parents or the youngsters? So when to come and why it is so important to come in time so that the treatment can be given? What are the
If
varieties of treatments? Yeah.
Yeah. See, if there is a hair growth,
Hmm.
immediately they will come.
Okay. Yeah, yeah, because it's looking
They are
bad.
worried. They
Okay.
are
Yeah.
worried. But
Yeah.
only obesity, then they may not
They
come.
don't bother. Okay.
Hmm. So, when usually they bring their mother, or mother brings their daughter. I
Hmm.
always tell
Hmm.
this: you listen to your mother.
Hmm.
Huh?
Correct.
Because mother says she's not eating vegetables, she's not eating this, and she
Correct.
eats only junk food. So that's why I tell them. I also
Yes.
tell them to take part in sports in schools or
Yes.
colleges. Okay.
Hmm.
Or if they're working, I tell them to go to gym and
Hmm.
change their habit of this dietary habits. Okay.
Hmm.
No junk food, not lot of sugar or oily things like that. They have to avoid, eat healthy food and
Okay.
do walking exercise. That this is the basic. See,
Basic.
tablets we can give
Hmm.
95%, it depends on them only. So
Yes.
5%
Yes.
it depends on the doctor.
Yeah.
Then we give
So
them.
lifestyle modification depends on the patient. And
Yes.
unless they do that, the
No.
tablets will not be very helpful. So if
Yeah.
the tablets have to be very effective, their lifestyle also has to change. And you
Hmm.
said they will have depression. So whenever a person goes into depression, the eating becomes more. They start overeating.
Hmm.
And that
It's a, yeah,
overeating leads
vicious
to
circle.
yeah, vicious circle.
Yeah.
So the
Yeah.
obesity and obesity
Yeah.
again to
Yeah.
PCOD. So
Yes.
I think younger generation should learn to take an example from Dr. Sunanda Kulkarni and me and remain very slim and trim, whatever the age, because, during the pregnancy, delivery, we put on weight, and then again during menopause, we put on. But those are the times they have to control. But these younger girls, even before marriage, they are becoming like mothers. So I think the weight control is extremely important. As you said, they have to have a physical activity. They have to do Surya Namaskara or the this Ganpati Namaskara and regular activities. And on top of that, this mind has to be very, very pleasant and happy rather than going into depression. Because for everything, there is a solution. Now, tell us the solution treatment for all these things.
Yeah, see the treatment, if they have infertility, we can give them tablets, they can become pregnant. And see hair, for the hair growth. So usually they shave and then epilation, and they all do. And then laser treatment is there. But see, if the hormones come down, now then it stops. So first, whatever is grown for that, they have to take treatment, and then we can give the tablets for that also. And then if it is very much hair growth, then we have to rule out other conditions which are responsible for this hair growth. And then they have to take a tablet to insulin resistance is there. They are more prone for diabetes in later life. So that's why they have to control their blood sugar, and they take tablet, even the tablets which are given for diabetes, some of the tablets we give them also. So
Yeah.
they can take,
So when you give metformin, the weight also reduces and the diabetes also is controlled. Yeah.
And to regularize cycle, we give tablets. Okay.
Okay.
And the this one the with the metformin we give tablets so that she becomes pregnant if she
Okay.
wants pregnancy.
Okay. Okay.
And
Okay.
then rarely there is a surgery. Rarely.
Okay.
But
What
nowadays
surgery is
surgeries
done?
no
What
one is
surgery is
doing.
done? Okay. Okay.
So previously there was wedge resection when I was student. Then the needle puncture came. So nowadays it is also not done. So with injections and tablet it can be reduced.
Tablets itself, it can be done. So you have a better drugs and the better medicines now. And
Hmm.
my question is, the girl is obese and the periods are irregular. What the mother should do and what the girl has to do, why it is important that they come early for the treatment, and who are the people who have to come for the treatment so that, the future complications are less.
See, mother, what she can do is very difficult because
Mm.
children, they don't listen to the mother.
Mm.
Only we tell them to
That
go.
is a
They,
universal phenomenon it has become. We were so
okay.
obedient, we never
Hmm.
used to cross whatever
That's
our
the
mother told. I
yeah.
remember your mother also, such a brilliant lady. And, we used to obey them. And that's why I think
Yes.
we are like this. Okay.
So they themselves have to learn
Mm.
the what to eat and what to not to eat, the control of the tongue, and then they have to do exercise. And already I have told you, if there is a facial hair growth, 100% they will come fast, running like that. So, but if there is obesity, sometimes they may delay. If the mother is obese and then the daughter is also obese, then both of them they should come. Not necessarily because of the PCOD, they are prone for diabetes and all that.
Mm.
So and then other diseases also. So they should come.
Mm.
So if the cycle is irregular, they have to come. Hair growth, they will come. Obesity, they can come. Or if there is a depression, mother can recognize that. Then she can bring her daughter.
Mm. No, that should
And
they go to any, yeah.
infertility, both
They
husband
have to,
and
they
wife,
will
they have to
definitely
come.
come. They will
And
definitely come.
near
Mm.
menopause also, if the cycle is irregular and they are obese and they are diabetic and they are hypertensive, all these problems, comorbidities, they have to come.
Yeah. So you do DNC for them.
Yeah, we do
Okay,
DNC to rule
okay,
out
okay,
whether it's an
okay,
endometrial carcinoma.
okay.
And then,
Thank you. Yeah, thank you so much, Dr. Sunanda. So nicely you have impressed upon our viewers that the importance of this PCOD, and earlier they come, the better the treatment and the better the result. So if they don't want to get into trouble in the future, they have to come early to the gynecologist. Thank you very much for your very beautiful presentation. Thank you.
thank you very much for giving me an opportunity.